So, imagine looking at a photograph of yourself, right?
Yeah.
And you suddenly realize your jaw is kind of sinking and your cheeks are sagging and your whole facial structure has just
Oh,
changed.
it's a huge shock for people.
Exactly. And for millions of people, this isn't just, natural aging, it's the physical reality of losing teeth.
Right.
So, welcome to today's deep dive. We're looking at this really eye-opening article by my gentle dentist in Arana Hills, and we're unpacking the realities of complete versus partial dentures.
And our mission today is really to dismantle that whole stigma of, like, clunky artificial teeth. We want to look at how modern dentistry actually restores both basic function and, well, your facial architecture.
Yeah, it goes way beyond just wanting a nice smile for photos.
It is a crucial shift in perspective, really. I mean, we tend to think of these prosthetics as purely cosmetic accessories, but clinically, they're absolute necessities. It's about preserving the structural integrity of your entire mouth.
Right, because the structural problems start the literal moment you lose even a single tooth.
They really do.
Which brings us to the first line of defense, right? Partial dentures. So think of your teeth like a tightly packed bookshelf.
Okay, I like that visual.
Yeah, so if you pull out a thick, heavy book and you don't put a bookend in its place, the surrounding books naturally tilt and drift right into that empty space.
That is such a great way to put it. What's fascinating here is that in dental biomechanics, the remaining natural teeth instinctively try to close that void.
Oh, wow. They just shift on their own.
Yeah, exactly. So a partial denture acts as your bookend. Modern partials use this metal or acrylic framework with very discrete clasps that actually grip onto your remaining healthy teeth.
Okay, so those healthy natural teeth become the anchors.
Right. They prevent that drift, keep the jaw aligned, and really stop the uneven wear and tear that happens when your bite is totally compromised.
But, that relies on actually having strong anchors left. Like, what if severe decay or gum disease just wipes out those remaining healthy teeth?
Well, that's when you're looking at complete dentures.
And mechanically, this is where it gets super tricky for me. Because without those clasps grabbing on to natural teeth, how do you actually keep them secured in the mouth?
It relies entirely on physics, specifically surface area and suction.
Suction, really?
Yeah, so a complete upper denture covers the entire roof of your mouth. That creates a very strong vacuum seal against the palate.
Okay, but what about the bottom?
The lower denture is a completely different story. It has to be shaped like a horseshoe, to leave room for your tongue to actually move.
Oh, right, because obviously you need your tongue. So less surface area means less suction.
Exactly. Because that horseshoe shape drastically reduces the surface area, lower dentures are notoriously much harder to keep in place.
That makes total sense. But there's this mechanical secret to complete dentures that most people totally miss. They act as the actual scaffolding for your face.
Yes, this is so important. Without teeth anchoring the jawbone, your facial muscles literally have nothing to drape over.
So you lose the internal support of your lower face.
You do. The muscles sag inward, which creates this severely aged look. But by putting a complete denture in, you actually restore the vertical dimension of the face.
Wow, just like that.
Yeah, you are physically propping those muscles back up to their natural profile. It acts like a highly effective instant anti-aging mechanism.
That is amazing. But, I hear the word dentures and I still immediately picture my grandfather's teeth slipping out at dinner or just looking completely fake.
That is such a common fear.
So if the functional benefits are that clear, how do we get past that very real anxiety?
Well, by looking at how the materials are actually engineered today, the My Gentle Dentist article highlights that we aren't using those generic opaque plastics of the past.
Right, they look so much better now.
Way better. Modern acrylics are layered and molded to perfectly match the precise contours of your specific gums. They use advanced imaging to craft a totally custom fit.
Wait, really?
Yeah, and the artificial teeth are color matched to the exact shade of your previous natural teeth.
So it's not just a one-size-fits-all plastic mold. It's basically a bespoke reconstruction.
Exactly.
And, if you're in Queensland dealing with this transition, clinics like My Gentle Dentist in Arana Hills are great examples of how accessible this process is now.
They really are. They do comprehensive bone density evaluations right at their plaza clinic to make sure the custom fit works.
And they offer flexible payment plans, right? To
Wow.
ease the financial side of things.
Yes, they do.
So you can literally just check them out at mygentledentistaranahills.com.au or give them a call at 07-3506-1234.
The overarching point here is that whether you're navigating this for yourselves or, for a loved one, Understanding these modern options changes the entire narrative.
It really does. It takes a scary medical transition and turns it into a reclamation of your confidence and honestly your identity. You
Yeah.
definitely don't have to live with a tilting bookshelf or a collapsing facial structure.
Absolutely. And looking ahead, it leaves us with this incredible question to ponder.
Oh, what's that?
Since modern complete dentures already restore facial muscle structure so effectively, how might future dental materials evolve?
What do you mean by evolve?
Like, imagine materials that actively communicate with and stimulate our jawbone, preventing the bone density loss that usually follows extractions in the first place.